This is a 44-year-old male who was referred to our surgical center after failure of anterior implants in the lower jaw. As you can see, there is a temporary restoration. The exposed coils of the implants are visible between the bridgework and the gingiva itself. In the CT scan, we can see that all three implants have lost more than half of their bone support, with medium to severe bone atrophy of the alveolar ridge in the vertical and horizontal dimensions. Phase A of our treatment plan will be executed under local anesthesia. We will remove implants number 32, 33, and 34 and perform vertical and horizontal bone augmentation using bone substitute and platelet-rich plasma. We begin the operation with the removal of the restoration and injecting local anesthesia, in this case, mercaine adrenaline. We remove the failing implants. As you can see, the removal is quite easy due to the severe bone loss around them. A crystal incision is made beginning on the mesial of tooth number 35 and reaching the mesial of tooth number 44. A mucoperiosteal flap is raised, taking care to protect the mental nerve on either side. The mucoperiosteal flap is raised on the buccal aspect and also on the lingual aspect. In order to receive platelet-rich plasma in this patient, we drew 60 cc of peripheral blood, which was centrifuged and prepared. The PRP is then added to the bone substitute, in this case xenograft, which we add granules of flagelle to the mixture. On the right side, you can see the PPP, the platelets per plasma, and now the adding of the thrombin. A collagen membrane is added to the PPP mixture. As you can see, this is the sandwich technique. On top of the membrane, we place another layer of the PPP. A periostal release is done on the buccal side of the flap. Cortical stimulation is performed by drilling holes in the buccal cortex using a high speed. Release of the periost on the lingual side is performed as well. Fitting and adjustment of the titanium mesh is being performed, bending it and cutting it so it will fit the defect that we have. When reaching the desired shape of the titanium mesh, we will place the mixture of PRP and bone substitute between the ridge and the mesh, making sure that the bone mixture is properly protected by the mesh. Fixation of the titanium mesh is being made by 2 osteomed screws from the buccal side. The entire area of augmentation will finally be covered by the 2 layers of PPP with the evolution collagen membrane sandwiched between them. Further release of the periosteum on the buccal side of the flap is being performed in order to receive a tension-free alignment between the buccal and lingual side of the soft tissue. Closure of the soft tissue will begin with mucosal sutures. The second layer of sutures are interrupted vertical mattress. Dermovat ointment is being applied to our surgical area before the beginning of the prosthodontics phase. A temporary acrylic bridge was adjusted and fixated to the remaining teeth. pressure dressing was applied to the lower part of the face in order to decrease the amount of swelling and edema post-surgery.